different topic. May I ask you about long COVID, please? And PHE's role, as it was, in relation to planning for and responding to the long-term consequences of long COVID. I think, is this right, that there wasn't any kind of communicate or public health communications plan in relation to long COVID, is that correct?
Yeah, so I think, I mean, just to reflect, so long COVID was something that, first of all, was being reported by individuals, I think particularly started to be reported in May and June, as weeks had passed since they had had their infection potentially in late February and March, and they were still not feeling better. I think that at the time, and I would say even still, we don't understand enough about long COVID to be able to give the right messaging. And I know that the NIHR, so the National Institute for Health Research, has put a lot of funding to try and improve that. From public health point of view, it is very difficult to give a message if we don't know what we're trying to do or reduce. I think what we were trying to do was reduce infections in whatever way we could, and by reducing infections, then we would therefore see less of an impact by long COVID. And finally, I would say that vaccination, when we looked at it, was clearly an important factor for reducing long COVID as well.
Can I just ask then one further follow-up question on that? Why is it then that Public Health England didn't collect data on long COVID, even though it collected data on long COVID? Sorry, let me start that question again. Why didn't Public Health England collect data on COVID, long COVID, even though ONS was collecting it, even though it collected COVID data when ONS was collecting it? In other words, collection by ONS wasn't a prohibition to the collection of data in respect of COVID-19 itself.
No, but ONS study was at that point being funded by PHE and UKHSA and very much involved those teams. It was the largest study of its kind globally to look at individuals and follow them over time. And so that was a very important part of what we do, is trying not to replicate it. Secondly, the other major source of where we collect data from is routine data that is collected at either the primary care or the secondary care level. And there was not routine coding that we would be able to analyse the data that was already being collected to understand who had long COVID in those settings. And there still isn't standardised coding to allow us to understand that.